As you know, leadership and accountability begin at the top, not with an undersecretary, not with a deputy undersecretary, but with the secretary. And these hearings are much more than opportunities for this committee to hear from the department. I think that it's important for the department to hear from members of this committee as well, because we hear from our constituents on a daily basis. There's no one better positioned to represent the VA than you. So again, let me reiterate my thanks for being here this morning. 2 days before the IG report was released, interestingly enough, VA made a surprise announcement that VA was going to be increasing their mental health staff by 1,900 people, adding approximately 600 clinicians and 300 support staff to their current roster of just over 20,000 mental health professionals. Ensuring that VA is staffed adequately to fulfill the care needs of our veterans and their families is a priority of mine, and I know each member of this committee. So on its face, this is an encouraging step. However, I am concerned by the timing and the implication of the announcement. The IG's report clearly illustrates that the VA does not have what I would call meaningful or reliable data, and that's what the IG's report says, to accurately measure a veteran's access to care or a facility's mental health staffing needs. In fact, the IG states, and I quote, "The complexity of the computations and inaccuracies in some of the data limits the usability of productivity information to fully assess current capacity, determine optimal resource distribution, evaluate productivity across the system, and establish mental health staffing and productivity standards," end quote. Which begs the question, if the VA doesn't even have a complete picture on the problem, and how confident can we be that access, in fact, will be increased and care enhanced by really what could be termed a knee-jerk reaction to what's been going on? And this isn't the first time we've been here. There's a long history of IG, government accountability offices, stakeholder reports that have found serious deficiencies within the VA mental health system of care, including appointments, scheduling processes and procedures, provider performance measures, and data collection efforts. There is an equally long history of congressional oversight. Strides have been taken, but they are far, far from enough. And I'd like to give the Department the benefit of the doubt. I believe that we all have the best interest of our veterans at heart, but I'm afraid that VA's response in this instance is yet another example of a Federal bureaucracy providing a quick-fix, cookie-cutter solution to a very serious, multifaceted problem. A true definition of access to care can be found in a 1993 Institute of Medicine report, which reads in part, "The most important consideration is whether patients have an opportunity for a good outcome, especially in those instances in which medical care can make a difference." The 1.3 million veterans who sought mental health care through VA last year deserve better. The very least we owe our veterans is a chance. VA can make a difference. VA must make a difference. And again, Mr. Secretary, thank you for being here today, and I yield to our ranking member, Ms. Brown, for an opening statement.